Hi everybody, I'm Jewel. Welcome to my channel. I've been doing a series of videos called Planning for Emergencies for people with kidney disease. The first video was about what you need to know, the supplies you need to have, paperwork, phone numbers, and such. The second video was about hemodialysis patients and everything that they need and what they need to do. And this one is for peritoneal dialysis, which I did for the last few years of my treatment before transplant. So here we go. Number one is keep a 2-week stock of peritoneal dialysis supplies. Check your expiration dates regularly and replace supplies when needed. If you use an ultraviolet device, keep the battery charged. Number two, include in your emergency medication pack a 5-day supply of antibiotic that your doctor orders for peritonitis. If a disaster occurs, it may be difficult to keep a clean environment and your chances of getting peritonitis may be higher. Peritonitis is an infection. So this is what the antibiotic is for. Number three, register with your local water and power companies so they will be aware of your need to get service restored as soon as possible. Guys, I told you, I think, in a previous video that this is what I did also. And my street where I lived was always one of the first ones to have their power, turned back on. Okay, if you use a cycler, you should also know how to do CAPD exchanges in case you are unable to use a cycler. If you use a cycler and lose power while dialysing, follow the instructions given to you by the PD staff for stopping dialysis in emergency. Okay, guys, this one is for transplant recipients, which is me. And I have to tell you that I learned quite a bit reading this article about what I need to do also. Number one is know your medicines and keep a 2-week extra supply in their original bottles, if possible. If you need to evacuate, original bottles will give you the necessary information when you get to your destination. Number two, a backpack with a waterproof pouch packed with key items should weigh about 10 pounds. Wear good shoes when you carry your backpack, leaving your hands free just in case you need to evacuate. Number three, pack key information, medical list, doctor, transplant coordinator, pharmacist, and insurance in a waterproof bag. You can add to the key information as specific to your health. Pack several 8-ounce bottles of water, a hand-operated can opener, hand sanitizer, travel bottle toiletries, disposable wipes, toilet paper, sunscreen, miniature flashlight, a mask, gloves, thermometer, batteries, machines, matches, and candles. Stock disposable eating utensils and canned and packaged rations of food such as peanut butter, saltines, tuna, juice, several days worth if possible. Include some dry clothes. If you have diabetes, follow guidelines on diabetic food choices. Bring any supplies you might need to treat diabetes or other conditions. Number four, if you are in a shelter or in contact with emergency personnel, let them know you are a transplant recipient and need to take medications regularly and on time. If possible, limit your exposure to infections. Sanitizers, gloves, and masks can help. Use common sense and remaining positive will also help, which is very true. Number five, ask your transplant healthcare team about precautions, additional medicines, and preparations that they recommend. You can find a list of transplant centers around the country from the United Network of Organ Sharing, which is UNOS. This is for patients with kidney disease that have diabetes. Make sure you have extra insulin and syringes. Keep a supply of sugar, honey, instant glucose, and glucose tablets low potassium juice, sugared low phosphorus beverages, hard candy in case of low blood sugar reactions. Number 3, keep extra batteries so you can check your blood sugar if you have blood sugar monitoring device. And number 4, ask for a copy of the emergency meal planning for diabetics. And you can get all of that information from the National um, Kidney Foundation website. They have all the information you need for the food that you will need for emergencies if you are a hemodialysis patient or a diabetic patient. So, guys, these are the emergency um, procedures that you need to take if you are on hemodialysis, peritoneal dialysis, and if you have diabetes and kidney disease. I'm hoping that this information will help you, which, it has helped me also because, like I said, I am a transplant recipient, so the things that they recommended for me, I didn't know, and so it really opened my eyes also. So, guys, if you like this video, please share, like, and subscribe. And I just want to let you know, guys, that we are thinking about you. We are, not worried about you because we know that you're going to get through this. And I just wanted to say to you guys, please stay positive. Um, Comply with your doctors and your medications. And remember, this is just a time in your life and it will pass. I promise you guys. So, in the meantime, take care of yourselves. We're thinking about you and sending you so many positive vibes. Take care, guys. Until next time, bye.